Welcome to today's Oncology Data Advisor interview. Today, I'm joined by two of our editorial board members, Dr. Matt Hadfield and Dr. Alankrita Taneja, who started off as members of our Fellows Forum and now are full-fledged editorial board members, having started their new positions about a year ago. And today, they're here to tell us a little bit about that first year after finishing fellowship and how everything's been going. So Matt and Alankrita, wonderful to have both of you on today. Maybe if you both like to start off by introducing yourselves, and then you can kind of take it away from there.
Oh, thank you so much. I'll give the honors to Dr. Taneja.
Okay, well, I started my faculty position at Jefferson Einstein Philadelphia Hospital. I've been here for about a year now, and I'm seeing hematology and plasma cell disorders here. So, Matt, would you want to, share what you are doing?
Yeah, no. So I am. Thank you. That it's amazing. That's already been a year. So I am a cutaneous oncology at Brown University in Providence, and I also focus on early drug development. So I see patients on first in human phase 1 studies. So I don't know how you feel, but I have found being an attending to be one of the harder years. As opposed to different years in training. I don't know if you share that same sentiment.
I completely agree with that because I feel like, when we are in training, we are expected to get, better, to keep learning and things like that. But once you're an attending, have to put your best game on, and, there's very little scope for mistakes. And it definitely, makes things challenging when you're not being supervised at all times.
Yeah, I would be curious to hear what your thoughts are on that because I feel the same way in that I think in training it's easy to think things are more straightforward when you're not actually the one owning the responsibility of making decisions.
Mhm.
Um, and I don't know, in my experience so far, I feel like more inclined to reach out to colleagues now than I did as a trainee, as a resident or a medical student or a fellow, because you do feel that added burden, I guess, of this is my decision and I really want to make sure all the T's are crossed and the I's are dotted. I'm not sure if you've had a similar feeling.
Definitely. And, to that point, so appreciate my mentors that I've had in training so far, especially fellowship. And I realize now that, just following everything in a more conservative manner rather than doing less, in terms of supportive management, for instance, is so much better, when you're in practice because, doing that. So, for example, doing prophylactic antibiotics for everyone with newly diagnosed multiple myeloma, right? That is something my mentor used to always do. And it's still, I think for more seasoned oncologists, it is still questionable whether everyone needs to really do that. But I think being in my first year of attending life, I think I'm just being more conservative, and just doing everything that I can do for my patient, which, makes me feel better that I'm protecting my patients in a way in that regard. But I think that those decisions are something that come more with more practice and more experience in the patient care realm.
Yeah, no, absolutely. And I think it'll be curious to sort of see the trajectory of how things change over time compared to now and 10 years or 20 years of practicing medicine. But one thing that I've really found is that subspecialty consults are for me not only just great in terms of getting opinions from people with different expertise than what I have, but also to learn from their clinical experience because there's so much you can look up and there's so much you can try and find a paper or a case series or whatever data you can find, but there's really very little that can be substituted for people's experience and tapping into that not just in your own subspecialty but in other subspecialties is for me has been critical because um you know patient care is very rarely ever black and white. It's very nuanced and gray areas, and at the end of the day you're making big decisions with patients safety and life, and you know it's good to be collaborative, but it's also great to learn from other specialists because I mean they just have a different perspective than you do. So, in that way, I've really enjoyed being and attending and getting to have more of those interesting conversations and learn to help take care of patients, but also to kind of tap into those experiences.
Mhm. Yeah, I guess that makes a lot of sense to me as well. And I think that's also where our tumor boards, are so helpful as well when you get to speak to different specialists, and you can all kind of chime in about various areas of expertise that everyone has and come together. I think there's a lot of learning and help that we can get from those kind of programs as well.
Yeah, no, I could not agree more. I guess so. I was thinking about this conversation, and I had a couple of thoughts. What would you say is one of the most unexpected things you've experienced this year as an attending that maybe you didn't anticipate?
There's a lot of stuff that is very challenging, I feel like, Matt, and it's all different. For instance, billing is very different, from training, RVUs and things like that, chasing those. I think that's something that we're definitely not prepared for in fellowship. At least I was not. How was your experience?
No, I mean, to be honest, I so we had a continuity clinic in fellowship where we managed patients. So I think some of the minutia that would pop up during the week, patient calls or things like that, even interacting a little bit with insurance companies, I got some insight to. But in terms of billing, the difference in billing codes, RVUs, how they're calculated, all of those things, I had zero experience, absolutely none. It was and to be honest, you just start working as an attending and you're expected kind of to know how to bill and looking at it that early is really important and making sure that would be another way you can find a mentor who understands that and kind of explains it to you because if you don't, you're going to be struggling quite a bit.
Absolutely. There is, I think once a month, every Tuesday, we have a course for, all kind of providers to learn about coding and billing that I so far have not attended. So I definitely
It
plan to do
sounds so
that.
interesting. I can't believe you haven't made it.
Exactly. Now you know why I did not, make time for that so far. But I think I have to because, that really becomes a major part of, some of the metrics that we have to, clear as in our, attending life. Um, so what about you? Do you have any such course, or are you just relying on mentorship for that?
I mean, we've had, guidance from our coders in terms of you know, presenting at division meetings and things, but no, there's no formal. There very well could be a course that I don't know about or haven't taken, and that's I mean that actually is one of the things that I think is an important kind of segue is that I think a lot of people feel like magically when you become an attending, you're supposed to just know things, like everything. And the
Mhm.
reality is nothing magical changes. Nothing magical changes when you become an intern versus a resident versus a fellow versus an attending. There's no like line you cross where all of a sudden like all the secrets that you didn't know. I mean, so being more humble, more willing to ask for advice, more willing to seek out the information and not being hesitant to ask, I think is even more important as an attending because a lot of people that I've spoken to who have had that transition from being a trainee to an attending, they feel very very you know uncomfortable asking for help because there's this imposter syndrome, like I'm supposed to, I've finished training and I'm supposed to know everything, and the reality is you just don't. So whether it's coding or a patient situation or how to write your notes, how to be effective in clinic, how to manage teaching fellows and residents, all these situations you've never been in before, mentorship is the most important thing, in my opinion.
Yeah, no, that's true. And I also think that, when in my first few months of, starting my job, I would say couple to 3 months, I think my chief here of the division was really involved in, showing me how to put those codes in and things like that. But I think after a while, it's only in between clinics that even he's doing this, right? So I feel like there was no real dedicated time to really learn this. And I think that, I would not, I think if I don't take that class, I'm never going to really know how to do this properly, unless like, you keep getting feedback from the billing department. And that's a harsher way to learn this, I think. But yeah, I
Yeah.
think I would say, people who are starting their attending job, I think this is something that they can look into.
Yeah, no, I absolutely agree. So with that in mind, what is there anything you would have done differently during your training to make you feel better prepared to become an attending?
Um, so again, this is a little specific for my situation, because so I trained in a program that was a comprehensive cancer center, and very
Sure.
different.
Oswald Park, right in Buffalo?
Oswald Park in Buffalo, and most of my so I was interested in plasma cell disorders and lymphomas, and most of my continuity clinic and mentorship were in that regard, limited to that area. And when I started my waiver job, because I'm in a J1 waiver as well, I'm seeing, in the community, I'm in a community, hybrid kind of practice, wherein I'm also seeing hematology, benign hematology, classical hematology. And I feel like I never really could, foresee that in training. I mean, I think I should have, and I could have gained more experience doing, more clinics in my free time, because in fellowship, I think we have so much research time that we can actually tailor our training to, doing things that we think would help us later on in our jobs. And I know some of my other co-fellows did do, who were interested in private practice, for instance. They did a lot of clinics to gain that extra experience to be more prepared for their job. And I think I could have also done something like that. Apart from just studying for the boards, but I think just getting more practical experience with wide range of patient population is something I could have anticipated. That is just a personal thing. I'm sure it won't relate to everyone. Um, what about you, Matt? I can think more, but I would listen to you, and maybe something else will also come to me.
No, I think honestly, I agree with you so much. Fellowship is very unique, especially oncology fellowships are very unique in that you might have the most flexibility of any aspect of your training that you're ever going to have. Honestly, probably in your whole career, because never as an attending can I imagine you getting 18 months of research time paid. So it's a very unique opportunity, and if you anticipate that you're going to go into a more clinically heavy job, I think, you know, spending your time in fellowship, writing protocols, while lots of value in that, might not be as practically helpful to help you transition to being an attending. And I would also say, I think one of the issues in training, especially fellowship, is there's just no way to get around it. There's a lot of shadowing. You join subspecialty clinics, you rotate through them, you see the different pathologies, but you're kind of just tagging along, um, and attending who's, if they've been doing this for a long time, they have very specific routines and patterns. They probably think a lot of things that they're not saying out loud. Um, in terms of managing toxicities or managing patients, making treatment decisions. And as much as you can, one of the things I regret is being more on autopilot during those clinics where I was just kind of like passively listening, because you didn't really have as much ownership of the patients. And I think it's harder because it seems very, very straightforward to you at the time, but when you actually are making decisions and managing patients, it's much, much harder. So I think, I would wholeheartedly agree with you. I mean, if you can manage to do more clinic time, try and be more proactive in clinic, it's going to serve you so well in terms of being an attending, because there's also things too. I mean, even like super simple things like, you know, learning how people manage clinic and get their notes done and stuff it seems trivial. It really does. But I mean, yeah, I'm sure you've gotten these messages, you have an off week and you don't finish your notes right away. The coders will start messaging you and sending you delinquency, notices. So like you need to be efficient and get things done and get your orders in and get your notes written in a timely fashion because one, it's good for patient care, and two, it's the only way to efficiently get your job done. And I wish I would have asked more attendings, like how do you do it? Like what's your um you know practice pattern, your how you manage this, because that's something that I'm still learning quite a bit about how I like to do things. I know personally I don't like to write notes when I'm in a room with a patient. I don't like to add things to notes, but some physicians do, and that works really well. So just finding like what works best for you is important, but also like in that rare opportunity to like be shadowing other physicians, you can really see a lot of different styles and how people manage things and cultivate your own practice.
Right. You're so right about that. When you say that you get into an autopilot mode when you're shadowing different attendings, that's exactly how I feel. I was, because in Roswell we didn't even have a continuity clinic, so that was that gave us even less autonomy on our patients. But I feel like just being more observant, and when we're training, we tend to think of our attending's job as a different job than ours in some ways, so we might not pay a lot of attention to all their moves. But I think we have to put ourselves in their shoes, and think in a way that we're going to be like them very soon, and just learn as many skills as you can. Because but I think also, Matt, in the early part of the attending life, we're also building our own style, I think.
Mhm.
So exploring different methods about when to write our notes, and in the patient room or not. I think that's something that we can also evolve over time. So to that note, actually, are you guys using any AI scribes?
We're not yet. I think we're actively exploring that. I just in terms of my own are you using AI scribes at
We actually are, and I love it.
I yeah, I can imagine it's probably making your life much, much better.
Mm-hmm. Definitely. We're using the Abridge, software, which, so as of now, it's not very well integrated with Cerner, the EHR that we have here, but I think with Epic, it, automatically, it's much better, it's more integrative and more intuitive and things like that. So I
See,
think,
that's the thing too. I mean, people coming out of training now, or honestly entering training now, like things are changing so fast with the way we integrate these tools like this that um, I do worry that kind of like autopilot that we mentioned could be even more so the case, because if you have been practicing for a while and you have a way you do things, and you're doing things and then you integrate in a tool that's like AI that helps generate your notes based on a conversation with a patient. You're not really like there's a lot of lost opportunity to verbalize what you're thinking in that situation with trainees. So it's going to be the responsibility of those that are training to try and really make sure that they're asking questions and being engaged as opposed to just kind of watching. Because yeah, I mean, I can tell you, you don't often stop and think like, what would I do right now if I was the attending? And sometimes attendings will ask you, and sometimes they don't. And the other thing is, I think when you're in a continuity or a shadowing or second site clinic kind of situation, maybe you go once a week or once every couple
mm,
weeks. You see different patients. You're not seeing all of them, and you don't know that like they call 3 days later and now they have like seven bowel movements a day, and
yeah.
I mean, that has to be managed, that has to be worked up, there has to be different things considered. So there's just a lot behind the scenes stuff that you want to expose yourself to as much as possible.
Absolutely, I guess something that trainees do need to keep in mind, that things are going to get very real in that sense. When they start their attending job, and it does start a little slow. So for example, I did have very few patients, and I slowly am building up. So I think that also eases us into the transition a little bit. But I know some people who are in private practice who are right from the start, they're seeing so many patients. So I guess if you don't keep that in mind in training, that it could get overwhelming, especially in the start.
Oh yeah, absolutely. And I think that's I'm not sure what your experience was with looking for jobs, and I'd love to hear your insight about being on a visa and doing a waiver job, because I'm sure that's a completely different experience. But understanding that kind of stuff, those are the questions that you don't necessarily ask and are really important to ask. Like, am I inheriting a patient panel, or am I starting new? Because if you walk into a situation where you already have, you know, 15 patients on a clinic day that are all follow-ups, but they're new to you. I mean, that is a very, very hard transition. Um, and you want to make sure that you're well supported to do something like that, because it's much different than starting your own patient panel where you're building up over, like to your point, 6, 12, 18 months, where you're slowly getting there.
Mhm.
And a lot of people are just too nervous to ask these questions because we're used to being, trainees, where we're kind of just, you match where you match. This is what it is.
Yeah.
You don't have any control, and then when you become an attending, you finally do have some say in your contract, your job, your situation. But yeah, I'd love to hear your experience.
You're absolutely right about that. And I'm still, I still think of myself as a senior fellow in my head. I'm not quite, very confident yet but I guess some people are, I think in your first job, I think many of us are very underconfident and don't really want to ask those tough questions to our employer. But I hope we get better with our, if at all, like a second job, maybe we can negotiate better. But job negotiation is a different ball game altogether.
Mhm.
And so for some of my co-fellows, for example, they inherited patients from locums physicians that were previously working in those practices, right? So that was they didn't really build their own practice, but they were just given a bunch of these other patients, which is very challenging for them, in many ways. So something to think about. So Matt, what has been your most favorite thing so far in your job? I know you said the collaboration is good. What else can you think about?
I mean, to be honest, there is nothing that can replace having patients that you take care of, because that's the best part of our job. Honestly, I have so many wonderful patients that are going through, these horrible diseases, and just being able to be there for them and be a part of that journey. I mean, obviously we try our best to take care of them, I'm not sure your experience, but I'm more and more humbled by medicine every day I take care of patients, because unfortunately there's just so much that's out of our control. But being there to be the person that is taking care of them with cancer is very, very hard, but it's very, very rewarding, and I think that's my favorite part of the job, no doubt. How about you?
Exactly same, ditto, if I could say. Yeah, because I think when we enter medicine, all of us have this sense of you want to help people, and then I think so far we're always just a trainee, and we don't really own our patients, like you said, so it's hard to know exactly the impact you have on your patients' lives. But I think that going the extra mile for our patients sometimes, and them appreciating it, and you can actually see how much you can help people out. I guess that's really the most rewarding part. I would agree. It's that's what makes it all worthwhile, right?
Right, right. No, absolutely. And I think, at the end of the day, that's you mentioned you feel like a senior fellow, but I feel like that wanting to do the best thing for the patient is honestly why we continue to feel like you're always kind of second guessing yourself a little bit, because honestly you realize how much there is at stake, and you want to make sure you're taking the best care of them as possible. And you know it is a humbling experience. Someone who's been practicing hemonc for 25 years still daily finds themselves in situations where they need to ask others for advice, and they're caught off guard by something, and just always remembering that this is a team sport more than an individual effort. I mean, I'm so grateful for the people that I work with, the nurses, the nurse navigators, the nurse practitioners that work with me. I mean, they're all wonderful, and they all contribute so much to the care of these patients. And without those people, you would be completely lost. And it's really, really important. I would say too, it's important to know like what type of situation you're walking into for support in those regards when you look for a job, because that matters a lot too.
Indeed, Matt. And I didn't have a navigator patient navigator when I started my job, but they were trying to hire somebody, and then they found a patient navigator for me, and she's amazing. And just life is just so much easier with having support to make those appointments, to check up on patients intermittently who are not doing too well and things like that. And I think support is really everything. And the MAs, the front, it's definitely a lot of team effort, and everyone really prides in that. Everyone really wants to help, and that part of the job is really good for sure.
No, absolutely. Well, Dr. Taneja, thank you so much for taking the time. I haven't had a chance to talk to you in so long, but I'm glad to hear you're doing well, and hopefully here's to another year of being an attending. So thanks for chatting.
Cheers to that. Thank you so much, Matt. Good to know you're doing well as well. We'll stay in touch.
Thank you.